Let's now discuss physical examination strategies, assessment techniques. The physical examination requires you to use your senses to assess the patient. You collect objective data regarding various aspects of the patient's health through sight, hearing, touch, and smell. Though strategies are discussed separately, it is important to realize that the history complements and validates the physical examination. The history and physical examination are the foundation of the treatment plan. The history obtained provides clues and guides you through the physical examination process. As the examination begins, some components of the examination process may prompt you to return to the history. Discreetly incorporating some history during the examination process facilitates the exposure of the principal or sometimes underlying diagnosis. Interacting with the patient. When conducting a physical examination, remember that encounters with the human body may be discomforting, embarrassing, and sometimes distressing for the patient. Your comfort level should never become so great that you forget about this often invasive experience for each individual patient. Respect the integrity of the patient while maintaining a professional courteous approach. Gaining the trust and confidence of your patient is essential for obtaining an accurate history and physical examination. As you are examining the patient is simultaneously examining you. The patient will note any hesitation or tone changes in your voice, how long you spend assessing certain body systems, and your facial expressions. Determining the scope of examination. Physical examinations are of two types, comprehensive and focused. As with comprehensive health histories, a comprehensive or head to toe physical exam should be performed on all non emergent new patients who will be receiving ongoing primary care from a particular provider or group of clinicians. A focused physical examination is performed in emergency situations and or when the patient is already under the ongoing care of the clinician and presents with a specific problem-oriented complaint. Assessment techniques. Inspection. Inspection involves collecting data through sight and smell. Upon first contact with the patient, you observe mannerisms, gait, stature, and various other physical qualities. Inspection provides significant insight into underlying diseases, disorders. Knowing what to look for and what it means helps focus inspection. Palpation involves using touch to collect data. Palpation is used to determine such characteristics as temperature, texture, tenderness or pain, and sensation. It is also used to establish information about internal characteristics, such as enlargement of the spleen. Depending on the amount of pressure applied, palpation can be characterized as light, moderate, or deep. Various aspects of your hands are used to assess different things. Percussion uses stopping to assess underlying structures. Percussion over a structure causes vibrations which can be felt and heard. Percussion is used to establish such qualities as location, size, density, and reflex. Percussion may be direct or indirect. With direct percussion, use your finger or hand to strike or tap the surface of the patient's body directly. For indirect percussion, place your hand over the surface of the patient's body and with the other hand, strike the first hand. Percussion sounds may be described as tympanic, hyperresonant, resonant, dull, or flat. Auscultation entails listening to body sounds and is particularly important for assessing the lungs, heart, and abdomen. Most auscultation requires a stethoscope, so it is critical that the provider invests in a high quality stethoscope that has excellent sound quality and is comfortable to use. Before you buy one, consider the following. Ear tips. It is important to use an ear tip size that best fits your ears. When the ear tips are in your ears, they should fit snugly, not loosely, so that the sound or acoustic performance is clear and loud. All ear tips are available in small and large sizes. Poorly fitting ear tips can result in a poor seal, which can lead to missing critical sounds. The seal. Stethoscopes rely on an airtight seal to transmit body sounds from the patient to the practitioner's ears. Loose parts in the chest piece and loose or cracked tubing can prevent an airtight seal. The bell. When using a double-sided stethoscope, you can use either the bell or the diaphragm. Sound quality and volume depend on a quality bell. Tubing. The tubing should retain its shape and flexibility even after being folded tightly into a pocket. Ideally, it should be made of material that does not contain materials that would irritate a patient's or provider's skin, especially those with allergies. Make sure the tubing is double lumen so sound is magnified. Thank you for your attention.